Hi, Dr. Donald Murphy. We're talking today about the changing landscape of healthcare and how that applies to us as primary spine practitioners. So, what we're going to be covering is what the situation is currently in the healthcare systems with regard to spine problems. And we're defining this new role in the healthcare system that is the primary spine practitioner, which we are already well familiar with. But we're going to be talking about how that is presented to the healthcare system, and also making sure you have a keen understanding of what exactly we're talking about when we say the primary spine practitioner and what you're embarking on in the process of this course. So some of you may be aware of Dr. Gordon Waddell, the orthopedic surgeon from Scotland. And back in 1995, and he reiterated this several times, currently in 2004, he declared that low back pain was a 20th century medical disaster. Now, after that declaration, we saw a whole bunch of papers coming out and experts in the field demanding changes in how we go about taking care of people with spine problems in a response to this disaster situation that we have in healthcare. Well, in that time, the problem actually has worsened. So after all those calls for dramatic changes in how we take care of patients with spine problems, the problem actually got worse. Yeah, worse. So back in 2000, 2004, low back pain was 105th on the list of causes of disability. As recently as 2013, back pain and neck pain were third in costs for neck and back problems. Now we see a situation in which they're number one in both. So things are worsening over time rather than improving. Now, we know the spine situation is messy. We have lots of non-evidence-based care going on out there. Patients are seeing the wrong practitioner at the wrong time. We have this spine supermarket situation out there that patients are going out into this field of spine problems, and they don't know what's right for them, and they have all these practitioners offering their wares to them. We have a lot of iatrogenic disability, but not so much because of harm to the patients. That happens sometimes, but it's mostly because of communication and what we refer to as the culture of relief. So we have a mess here in spine problems. And the worst part of this is that the patient is caught in the middle of this whole mess. So what we're trying to do systematically is bring order to this chaos. Go from this chaotic situation in spine problems to order, and of course, turning the patient into a victor rather than being a victim. So, one of the things that we see going on in the field as a whole in healthcare is they're trying to move the focus more towards primary care, and in most areas of medicine that works pretty well. But in spine problems, that's problematic. For one thing, primary care practitioners are already overburdened with what they've got to take on now. Also, more importantly, primary care practitioners, by and large, don't really have a lot of training and background in diagnosis and management of spine problems. And as a result, this recent survey in Consumer Reports, where they surveyed readership, people who had low back pain, and they found that primary care practitioners ranked last in the list of patient satisfaction in comparison to all other practitioner types. So when it comes to spine problems, focusing on traditional primary care practitioners in isolation doesn't really work. We have this study that was recently came out that the lead author was Joel Stevens, where they found that 50% of primary care practitioners utilized approaches to patients with low back pain that were not consistent with guidelines. As a result of that, when they looked at transition from acute low back pain to chronic low back pain, they found that primary care practitioners not following guidelines was an independent risk factor for becoming chronic. And the more of those recommendations from primary care practitioners that were not consistent with guidelines, the greater the risk of the patient becoming chronic. So that's not a good situation. So that brings us to the solution that we are bringing to the healthcare system, and that is the primary spine practitioner. And in broad terms, the primary spine practitioner can be seen as primary care. And I put that in quotes because we're not trying to be traditional primary care practitioners, but we're providing a form of primary care specifically for patients with spine problems. So this is not unfounded or unprecedented. So there's a lot of people in the healthcare system that are calling for what they call retooling of the existing workforce. That is, taking existing practitioners, existing professionals, and retooling them to play new innovative roles in the healthcare system. And that really applies to the primary spine practitioner. So what we're doing here with this PSP training that you're going through is we're taking mostly physical therapists and chiropractors, although there may be others down the road, but mostly physical therapists and chiropractors, and we're refitting them to play this new innovative role of the primary spine practitioner. Okay, so that's the end of part one, and stay tuned for part two. Thank you.